A very good evening to one and all our viewers, and I am Dr. Surabhi Mitra, your host and moderator of the evening. And today's topic is about sleep and how to sleep well. And I guess this is very, very important as almost I think everybody's sleep cycle these days is quite disturbed because of their work routines, because of the stress they have, and because of a lot of other factors like, household chores, handling their own children, babies, pets, husbands, wives, etc. So, moving ahead, with this topic, it has been brought to you by Evrox Healthcare, which is a digital healthcare company. And its flagship product is the F1 app, which is being launched soon, which would help a lot of doctors, nutritionists, mental health care workers to reach out to you through their teleconsultations. And that is how we are recruiting more and more of them. So please do join us and let us know what you think about it. You can get the demo of this app when you text us on the number that flashes on the poster, or you can visit our Facebook or YouTube page and let us know. So, starting with the topic, today's topic is about sleep, as I already mentioned, and we would be having Dr. Neha Bhave Salankar, who is a psychiatrist and she works at the Bhave Institute of Mental Health at Nagpur. She passed out from Goa Medical College and she was a gold medalist there. So, please welcome my senior, Dr. Neha Bhave Salankar.
Hi, hello Surabhi. Thank you so much for having me over.
Thank you, Dr. Neha, for accepting the invitation and also for suggesting this topic because it is one of your favorites.
Yes, I'm very passionate about this topic. I love my sleep.
Yeah, it would definitely help me to improvise on my sleep cycle because it's a disaster as of now. Okay, moving ahead with the second speaker, we have not doctor, we have Sanjeev Chakraborty, who is also the founder of Evrox Healthcare, and he's with us today, and he's going to show his face finally for the second time on the screen. And he is also a sleep specialist and a nutrition specialist. So he would be talking mostly about these aspects as well as certain other aspects as well. So, welcome, Sanjeev Chakraborty.
Hey, hi Survi. Hi, Dr. Neha.
Hello.
So I think because the basic first topic starts with the neurobiology of sleep, we should actually start with Sanjeev. So if
Okay.
or both of you can pitch in definitely, howsoever. So, neurobiology of sleep. So how does sleep work, and what happens during the sleep, like the sleep stages that we talk about?
I think maybe Dr. Neha can start and I can add
Yeah, yeah,
points
she
to.
can.
Yeah, definitely. So basically, sleep का भी एक structure होता है. We call it sleep architecture, and sleep uh, is divided into different phases. When we are sleeping, we don't realize any of it, but there's a lot of brain activity that goes on during sleep. And हो सकता है आप में से किसी ने ये terms सुने हो. Some part of sleep is called REM or rapid eye movement sleep, and the other part of sleep is the NREM or the non-rapid eye movement sleep. बेसिकली क्या होता है थ्रू आउट द ड्यूरेशन ऑफ योर स्लीप आपका स्लीप स्ट्रक्चर जो है वो चेंज होते रहता है आपके स्लीप के इनिशियल पार्ट में आपका नॉन आरईएम फेज ज़्यादा होता है बाद बाद में आरईएम फेज ज़्यादा आता है राइट सो थ्रू आउट द नाइट योर क्वालिटी ऑफ स्लीप कीप्स चेंजिंग अब शॉर्ट में अगर बताना चाहूँ तो बेसिकली स्लीप जो है दैट इज ड्रिवन बाय टू रिदम्स एक होता है सर्केडियन रिदम जो आपका डे नाइट साइकिल से कोइंसाइड करता है एंड दूसरा जो फैक्टर होता है वो होता है स्लीप प्रेशर जब हमारे ब्रेन में एडेनोसिन नाम का एक केमिकल बिल्डअप हो जाता है इनफ क्वांटिटी में तो उससे स्लीप स्विच गेट्स फ्लिप्ड ऑन एंड दैट हेल्प्स अस गो टू स्लीप सो देयर इज अ सर्केडियन रिदम एंड देयर इज द स्लीप प्रेशर राइट जब हम सोने जाते हैं इनिशियली वी आर इन द एनआरईएम स्लीप अब इसमें भी चार स्टेजेस हैं स्टेज वन इज जहाँ पे हम ड्रिफ्ट ऑफ हो रहे हैं इफ यू एवर सीन स्मॉल बेबी स्लीपिंग तो उनमें ये आप बहुत ब्यूटिफुली ऑब्जर्व कर सकते हैं नो देयर अ स्टेज जब आंखें जस्ट बंद हो रही होती हैं एंड बहुत ही लाइट फेज में होते हैं बिटवीन काइंड ऑफ अवेक एंड अस्लीप तो ये स्टेज वन होता है उसके बाद आता है स्टेज टू इसमें जो है आपका बॉडी स्टार्ट्स वाइंडिंग डाउन, मतलब आपका हार्ट रेट कम हो जाता है, बॉडी टेम्परेचर स्लो हो जाता है, आई मूवमेंट्स कम हो जाते हैं। एंड देन कम स्टेज 3 एंड 4 जो कि डीप स्लीप होता है, मतलब इस नींद में से अगर यदि हमको जगाया जाए देन वी वेक अप वेरी ग्रॉगी एंड डिसओरिएंटेड, सो दैट इज स्टेज 3 एंड 4। एंड इसके बाद आता है आरईएम स्लीप, रेम स्लीप। रेम स्लीप की स्पेशलिटी ये है कि इसमें हमारा ब्रेन बहुत एक्टिव होता है, आवर ब्रेन इज वेरी एक्टिव इन रेम स्लीप। मतलब जो ब्रेन स्टडीज होते हैं ड्यूरिंग स्लीप, सो यू नो ऑक्सीजन कंजम्पशन लेवल ऑफ द ब्रेन इज वेरी हाई, ब्रेन एक्टिविटी इज फाउंड टू बी वेरी हाई। बट बॉडी जो होती है, जो मसल्स होते हैं, there's a complete loss of muscle tone, so the body is very inactive but the brain remains very active. This is the REM sleep. So this is the basic architecture of sleep.
Okay, Sanjeev, would you like to add to it?
Yeah, she has more or less covered it, I think. The only part I think I would like to add is that the last stage is the one where we dream. So it gets a little vivid, and the REM phase where the sleep gets very deep. Uh, you know, there is a certain kind of muscle paralysis. So what happens is, except for the eye and the breathing muscles, the lungs and all, the rest of the body, you probably, if you watch someone sleep, there are observations made that the body gets into a paralysis mode. So there is something called muscle atoning. So when a person is dreaming, you can see that the person, mostly there is a lot of eye movement, and rest N1, N2, N3, and N4. Dr. Neha has already described. So more or less that's about it. That is how the architecture is laid out. That is what happens.
Yeah,
But
as it is, we were
it's
coming to
very
the
complex.
functions of different stages after this.
It's
Yeah,
a
so
very, it's a very complex process, a very dynamic process. There is, we have only observed how it happens, but exactly what causes it, how it all happens, there's a lot of research still going on with it. So it's an ongoing process, to be honest.
okay, so after this, we were going to come to the different functions of different stages of sleep. So I think we should go ahead with that now. So, Dr. Neha, would you like to start with it?
Yeah. So again, इसमें भी REM sleep has different functions, NREM sleep has different functions. तो REM sleep जो है, um, that is important in discerning facial expressions. मतलब आप facial expression से जो body language किसी का read करते हैं, I'm so sorry, excuse me. When you read somebody's facial expressions, तो वो जो है, अगर आपका रेम स्लीप कम है तो ये जो फेशियल रीडिंग होता है वो कम हो जाता है। दिस स्किल इज वेरी इंपॉर्टेंट इन इंटरपर्सनल रिलेशनशिप्स। एंड कुछ कुछ प्रोफेशंस होते हैं जैसे कि पुलिस पर्सनल हो गए या लॉयर्स हो गए, उनके लिए दिस फंक्शन ऑफ द ब्रेन इज वेरी इंपॉर्टेंट। Again, after that, REM sleep helps in improving creativity or creative problem solving. REM sleep is known to sort out parasitic memories. मतलब हम दिन भर में भी register, our brain logs in like so much information. उसमें से क्या रखना है क्या नहीं रखना है, ये function REM sleep का होता है. Kind of works like a छलनी, जो useless information है sieves out and the important stuff is kept in the brain. Then very important function of REM sleep is जिनको किसी भी टाइप का साइकोलॉजिकल ट्रॉमा होता है, sleep में, in REM sleep when they are dreaming they revisit that trauma and this helps in resolution of trauma resolution का एक बहुत important aspect है कि जब हमें small doses में ओरिजिनल ट्रॉमेटिक इवेंट का एक्सपोजर रहता है, जैसे फ्लैशबैक्स हो गए या टॉकिंग अबाउट दैट इवेंट या हियरिंग अबाउट इट, सो उसी तरह स्लीप में जब हम ड्रीम करते हैं अबाउट ट्रॉमेटिक एपिसोड्स, इससे देर इज वेरी इफेक्टिव रेजोल्यूशन ऑफ ट्रॉमा। इट्स अ वेरी सो टू से पेनलेस वे ऑफ ट्रॉमा रेजोल्यूशन। आई मीन हम सब ने एक्सपीरियंस किया है कि कई बार हमें वी ड्रीम ऑफ सम painful experiences that we've had in the past, but that's our brain's way of kind of resolving that trauma. And another important function is कि REM sleep में हमारे ब्रेन का जो नॉर एड्रेनलिन नाम का हार्मोन सिक्रीशन होता है वो स्विच ऑफ हो जाता है, विच इज लाइक अ स्ट्रेस हार्मोन ऑफ द ब्रेन. सो स्लीप इज अ नेचुरल रिलैक्सेंट, रेम स्लीप. देन नॉन रेम स्लीप जो है, एनआरईएम स्लीप जो है, it has again multiple important functions. I think the most important being memory. So memory का जो aspect है non REM sleep का, this is crucial for students, for people who are in their academic careers and learning phases. um, क्योंकि it helps in making new memories and retention of information. जब हम सोने के बाद पढ़ने बैठते हैं, इट रिफ्रेशेस आवर ब्रेन्स एबिलिटी टू लर्न न्यू इन्फॉर्मेशन, राइट? अगर आप अच्छी नींद लेके फिर पढ़ने बैठ रहे हैं, तो यू कैन रिटेन दैट इन्फॉर्मेशन बेटर. एंड कोई नई इन्फॉर्मेशन पढ़ने के बाद व्हेन वी गेट अ गुड स्लीप, तो ब्रेन जो है उसको, ब्रेन में उस मेमोरी को सॉलिडिफाई करता है थ्रू अ प्रोसेस कॉल्ड कंसोलिडेशन. So sleeping before learning refreshes your brain, and sleeping well after learning consolidates this memory. और एक मेमोरी फंक्शन है जिसको हम बोलते हैं टारगेटेड मेमोरी एक्टिवेशन. इसका ये सिंपल मतलब है कि अगर सोने के पहले आप सिर्फ हाइलाइटेड पॉइंट्स या नोट्स पढ़ के अगर सोएंगे, सो उन हाइलाइटेड पॉइंट्स का रिकॉल नेक्स्ट डे बेटर रहेगा. बेसिकली दैट योर ब्रेन reactivates only targeted memories, right? So this is again, like I said, it's very important for students. एक बात यहाँ बहुत जोर देके कहना चाहूंगी कि ये जो नाइट मारने वाला सिस्टम होता है, which is there with so many students before exams, before vivas, this is rubbish. This is rubbish. I have seen so many people do it, and it just hurts your performance so much. Matlab, there have been studies again for this, and we are scientific people, we talk in numbers. So there's a 40% poorer recall after an all-nighter, night मारने के बाद, because it's a double whammy. आप बिना सोए नया मटेरियल पढ़ रहे हैं, so your brain is not refreshed, like I said, and because after reading that new material you are not sleeping, so memory consolidation नहीं हो रहा है. So basically जो आपने पहले पढ़ा है वो भी आपको ढंग से याद नहीं आ रहा है, and नया जो पढ़ा है उसका रिकॉल तो anyway पुअर रहने वाला है. So it is just a wasteful process. I always tell all my students that please night नहीं मारना है. Ensure 7 hours of sleep before your exams. It is not going to help you in any way. So this is very important. Uh, Another function of non-REM sleep is it's very interesting. It helps in motor skill enhancement. मतलब आपके जो मोटर स्किल्स या जो मसल से आपके काम करने वाले स्किल्स होते हैं ना, इसमें हेल्पफुल रहता है नॉन रेम स्लीप. नाउ दिस इज इम्पॉर्टेंट फॉर एथलीट्स, जो लोग एथलेटिक्स में है, स्पोर्ट्स में है, स्पोर्ट्स पर्सन बेसिकली, फॉर म्यूजिशियंस जिनका मसल मेमोरी पे काम चलता है. इनमें बहुत देखा गया है कि they are giving a performance with inadequate sleep, right? So performance poor होने के chances बहुत ज़्यादा हैं, right? In sports persons, जैसे अगर आप adequate sleep नहीं ले रहे हैं, तो there's faster exhaustion, lactic acid build-up muscles में ज़्यादा होता है, oxygen desaturation ज़्यादा होता है, carbon dioxide muscles में build-up ज़्यादा होता है. So all this happens because of sleep deprivation. Um, One pro tip, Usain Bolt is famous for taking a nap before his performances, because he feels it enhances his athletic performance. Then जो deeper stages of sleep होते हैं, 3, 4, they work by improving your immune system, and again, these deeper stages of sleep are also natural relaxants. So yeah, those are the functions of sleep.
All right, all right. Very informative and very elaborative. Thank you for that, Dr. Neha. And Sanjeev, I can see it on your face that you probably want to add something to this. So
No,
please go
no,
ahead.
she has been on point. There is nothing to add. She has
Nothing
been
that you would
absolutely
want.
on point. Yep.
Okay. Okay, so we were talking about this, night sleep and early morning sleep, and how it is very important to have a good night's sleep. So, is there any difference in between the early night sleep and the morning sleep? I mean, is it okay if a person sleeps from the morning to the afternoon, or it's not? I
So
mean, Dr.
basically,
Neha
like
can
I
start.
said,
Yeah, yeah,
like I said कि जो सर्केडियन रिदम होता है ना, द डे नाइट साइकिल जो होता है,
yeah, yeah.
it's important that your sleep cycle should kind of coincide with that, right? Because uh, we are solar powered creatures. You know, our brain is designed to be awake during the daytime and asleep during the nighttime, basically during the dark, right? So it's a misconception कि मैं अगर सुबह 5 बजे से दोपहर के 1 बजे तक सो रहा हूँ, I'm getting 8 hours of sleep and that's enough. No, that's not enough, because your body clock is out of sync with the circadian rhythm. So that is going to cause problems in all these aspects, you know, memory and muscle enhancement, motor skills, everything that we spoke about. So just the quantity of sleep is not important. When you are sleeping is also very important.
Okay, so is there any difference, as in to the immune system, to the physical health, to the mental health?
Yeah, matlab, all the functions of sleep that I just elaborated, you know, it doesn't work as well when your body is out of sync with the circadian rhythm. I mean,
Right.
you wake up feeling not as refreshed as you would, even if your quantity of sleep is more. You might end up more drowsy during the day. Your concentration levels might be poorer. Your memory recall might be impaired. So all of these things happen when your sleep cycle has shifted from the time of the night to time of the day.
Okay. Okay. So, in case if a person, regularly has this issue of not getting proper sleep, that is, a continuous lack of sleep. So, how harmful is it, and what are the harmful effects that can happen?
राइट. सो इसको वी कॉल इट क्रॉनिक स्लीप डिप्राइवेशन, मतलब जो नींद
Yes,
कॉन्स्टेंटली कम
yes.
आती है, यू नो. एंड क्रॉनिक स्लीप डिप्राइवेशन इज it's very harmful for your higher mental functions. So for students or for working professionals, you know, it really impairs your concentration and your ability to focus on anything. Um and it can be really fatal in conditions like when you're driving, right? So drowsy driving accidents hote hain. Basically what happens is when you're chronically sleep deprived, your brain goes into micro sleep breaks in the daytime also, wherein your, you know, eyes might partially or completely shut for a couple of seconds, and then that can lead to disasters when you're traveling on the road, or, you know, when you are driving, those kind of things. So that is one big issue, like you are non refreshed, you are drowsy throughout the day. That is one big problem. Another problem we see is with emotional regulation. There's a part of our brain which, in scientific terms, is called the amygdala. So amygdala जो होता है, that is the seat of emotional regulation. And in patients जिनमें chronically नींद कम हो रही है, amygdala का activation is seen to happen 60% more. So all your primitive negative emotions like anger, aggression, irritability, these are seen more commonly. You are unable to, you know, keep yourself calm and regulate your emotions as well when you're sleep deprived. Uh, then there have been a lot of studies in prison populations also, you know. So in those people, it's been seen that when you're sleep deprived, आपका aggression ज़्यादा है, violence ज़्यादा है, you know, bullying behavior ज़्यादा रहता है. And another impact that it has is on your physical health, because chronic sleep deprivation is shown to increase the incidence of illnesses such as Alzheimer's disease or coronary artery disease, strokes, those kind of effects.
And I think we have been talking about a lot of hormonal effects also that sleep deprivation can have, because generally it's told to women, or the girls who have attained their puberty, that your
Yeah.
menstrual cycles would be irregular, other cycles
Yes.
would be irregular, even the appetite would be dysregulated. Okay, so Sanjeev, you have been quiet for a long time, I guess. Would you like to add something? You are muted. You have to unmute yourself.
Right. Yeah, so she has done a great job. So I was just listening to her with rapt attention. Absolutely on point. And a couple of things I would like to add is, apart from immediate effects that chronic sleep deprivation brings about, some negative effects like, as we were discussing, hormonal imbalance, learning and cognition issues, memory, growth issues, uh, sometimes exercise performance for a lot of people who are into sports, some kind of sports. For them, lack of sleep, they can determine that there are immediate effects of lack of sleep. But there are long term effects as well, as we were discussing. There's overall quality of life that will take a hit. Your productivity, your mood, uh, overall mental health, cardiovascular, pulmonary health, all these things. One important thing is recovery. As when we sleep, as Dr. Neha was saying, that when we sleep, our body goes into a phase where a lot of healing happens, right? So that if you're not sleeping enough or if you're not sleeping well, that healing doesn't work very well. So for post-operative patients, patients who have undergone surgery, for them sleep can be very very critical, because that kind of recovery won't be possible, or it will be hampered. Then there is inflammation. It promotes inflammation, lack of sleep, obesity, diabetes. So you name it, you get it. Sleep is very underestimated, to be honest. It brings about a lot of issues. And to add to what Dr. Neha has said, I'll explain. I'll try and explain it in a easy to understand method. तो क्या होता है कि there is something inside our brain which is called SCN. तो मैं medical term में नहीं जा रहा हूँ. There's a it's consider this as a photoreceptor. So why circadian cycle? Why we are solar, animals? Why we do? थोड़ा evolution में भी जाते हैं. Electricity वगैरह कुछ नहीं था. So it was
Okay,
only
that would
about
be
getting up
interesting.
in the morning. Yeah, so it's only about getting up in the morning when there is sunlight. You go out, hunt, get food, come back. When there is dark, you also become you can also become prey to other animals, because your eyes are not suitable for darks, right? So human history, throughout human history, we have learned to stay inside or stay safe during the dark times. So we have taught ourselves to be awake during the daytime and asleep during the the second half of the day. So what happens is, when when people uh, when people have observed this over a period of, let's say, 10,000 or 20,000 years, the evolution brings about a lot of change in the body. And let's say one of the important change, thing in the body is that photoreceptor, which basically tells our body that now there is light. So this is the time where you should be active. And when there is no light or there is darkness, that same receptor, it gets into a state where it tells our body that there is no light, it's dark outside, which means this is the time where you should stop your activities, you should get some sleep, you should heal, you should get the energy to get all those food that you have consumed, food that you have eaten, that this is the time where you put them to good work, you have digested them, now you heal, and next morning when there is light again, you again go out and start hunting. So this SCN, or suprachiasmatic nucleus, which is the medical term, this is the one which basically controls the circadian rhythm. Now ये सर्कैडियन रिदम से क्या होता है? सर्कैडियन रिदम बॉडी को एक डिसिप्लिन में चलने के लिए मजबूर करता है, और एटलीस्ट सजेस्ट करता है. नाउ इट्स अप टू अस वेदर वी लिसन टू इट और नॉट. People who sleep at night, people who get bright sunlight during the daytime, they follow the circadian rhythm. The body behaves, and but the body is disciplined, so they get good sleep, they heal well, their mood is usually elevated, their productivity is usually high. इफ यू डोंट डू दैट, एज यू आर आस्किंग, कि अगर दिन में हम लोग सोते हैं और रात को हम लोग जाग जाग के काम करते हैं, तो क्या होगा? वॉन्ट वी सर्वाइव और वॉन्ट इट वर्क? यस. Even if you get sleep during the daytime, it will do its work. There will be N1, N2, N3 stages and all. But since there is light outside, and the receptors, despite our eyes are closed, the receptors can still sense the light. सो इट विल कंटिन्यूअसली सेंड एन फीडबैक लूप कि अभी दिन है, अभी लाइट है, तो अभी दिस इज द टाइम टू डू थिंग्स लाइक गेट एक्टिव एंड स्टफ. So there is a lot of conflict and clash between your circadian rhythm, your internal clock which tells you to be active, and your schedule which is forcing you to sleep. So that is why, despite sleeping during the daytime, you might later on feel that you are sleepy. This can cause excessive daytime sleepiness. If you're not sleeping at night, during the night, your them, your Dr. Neha is also there. You guys already know, and you'll probably discuss later as well, that the melatonin levels are usually high during the night. सो दिन में जब कम है तब यू आर ट्राइंग टू स्लीप, रात में जब ज़्यादा है तब यू आर ट्राइंग टू स्टे अवे. So that conflict can give rise to a lot of physiological issues.
Yeah, sorry. So to add on to this, I would like to ask Dr. Neha that, say for example, a person is continuously into this cycle of, night working and day sleeping. So does it alter the levels of melatonin during the night time, and are there changes likewise? Also, another question to add on to this is, say for example, a person is working in the night time with all the lights on, with the electricity and all, but in the daytime the person is, putting off all the curtains and सब कुछ properly बंद करके अगर darkness में सो रहा है, तो उससे फायदा है क्या? ये दो चीजें जाननी थी.
राइट. सो बेसिकली मेलेटोनिन का फंक्शन ऐसा है कि इट गेट्स सिक्रीटेड इन योर बॉडी, it gets secreted in your brain after darkness falls. Rather, once the light is gone and once you are in darkness, उसके almost से 2-2.5 घंटे बाद melatonin secretion in your brain starts. And the function of melatonin is it tells your brain कि भैया it's time to sleep, right? So now when you say that we are studying with or working with all the lights on and being exposed to bright light, so आप जब ये lights off करेंगे, right, उसके करीब 2 घंटे बाद 2.5 घंटे बाद your melatonin secretion will peak and then it'll tell your brain that now it's time to sleep. So होना क्या है कि normally around say 7 o'clock there's nightfall, and then by 9-9:30 your melatonin is secreted and it tells your brain up sona, and after an hour or so after that is when we actually go to sleep. Now push this ahead by whatever number of hours you're working late into the night, right? So say till 11, 12, 1. So then your whole cycle gets shifted samne. So then when you are exposed to screens, bright lights till late in the night, your sleep onset gets delayed. There's higher sleep latency, because फिर ऐसा नहीं होता है that you go into bed at 11 and you fall asleep within 15 minutes. No, then your brain tends to wind down and go off into sleep 1.5 2 hours after that, right? So the harmful effect of this is, the harmful effect of excessive light or screen exposure is there's a delay in sleep onset. एंड मेलेटोनिन का कैसा है कि इट गेट्स व्हेन देयर इज अ लाइट फॉर व्हेन देयर इज लाइट आउटसाइड, उसका सिक्रीशन अपने आप कम हो जाता है. तो आप भले ही दिन में लेट सो रहे हैं एंड देन रात में आगे लेट उठ रहे हैं, बट मेलेटोनिन जो है वो बॉडी क्लॉक आपका डिसरप्ट होते रहेगा फिर. सो देन इट डजंट वर्क दैट वे.
So even if we create an atmosphere of entire darkness during the daytime, and even if there is light during the nighttime, it will still be disrupted, right? So you need
Yeah, because
to
your
sleep.
body is ideally used to being, is used to kind of being exposed to say 9 hours of darkness and subsequent 12, 13, 14 hours of daylight. So by artificially creating this darkness light pattern, आप उस time frame को break कर रहे हैं. So then your
Yeah.
melatonin secretion is bound to get disrupted.
Okay. There was a similar question flashing. Admin, could you just flash it? Yeah. What if a person is doing his or her night shift for a prolonged time and they have to stay awake during the night and sleep during the day? Yeah, I think the same question.
Yeah.
Okay. So, now one of my favorite topics as well. Let us move on to what are the illnesses or disorders associated with sleep. Somewhere I used to love the subject during psychiatry. So, Dr. Neha, would you like to start?
Yeah, I'll talk about this briefly. Basically, there's different problems associated with different phases of sleep and also quantum of sleep. So जहाँ कम नींद आती है, we call it insomnia. That's a problem of not being able to sleep enough. And जहाँ बहुत ज़्यादा नींद आती है, we call it hypersomnia, right? Now there's also specific illnesses which are related with sleep. One of them is called narcolepsy. Narcolepsy is typically जहाँ पे you get sleepy excessively during the day. You might have sleep attacks or cataplexy जिसमें suddenly body loses tone and the person might go weak in the knees or might fall down. So they might have these sleep attacks, and at night then there's a lot of sleep latency. They are not able to fall asleep quickly enough. They snore a lot. So these are symptoms of narcolepsy. Then there's another set of sleep disorders which is got to do with your airway और योर रेस्पिरेशन. उसको हम स्लीप एपनिया बोलते हैं कि जब रात को सोते सोते आपका ब्रीदिंग कॉम्प्रोमाइज हो जाता है. दिस कैन बी ऑफ टू टाइप्स. वन इज ऑब्स्ट्रक्टिव स्लीप एपनिया जहाँ पे बिकॉज योर एयरवे इज कॉम्प्रोमाइज्ड और योर एयरवे इज कोलैप्सिंग. So your airway is obstructed and that's why you can't breathe well enough. The other is central sleep apnea जहाँ पे because of some brain related or central nervous system issues your breathing gets compromised. So इसमें क्या होता है, in sleep apneas there are micro breaks in the sleep. Sometimes the patient might wake up with a choking sensation. Sometimes it might be a very small break in sleep which the patient doesn't realize. But these patients are often classic snorers. They snore a lot. A lot of them have got abdominal obesity, which causes which adds to their snoring. And they typically wake up with headaches, with a dry mouth. That is a symptom of sleep apneas. उसके बाद आते हैं आपके पैरासोमनियाज एंड मूवमेंट डिसऑर्डर्स. सो जैसे कि मिस्टर संजीव वाज सेइंग कि जो हमारा रेम स्लीप रहता है उसमें नॉर्मली मसल्स गो इनटू एटोनिया, मतलब मसल्स में कोई टोन ही नहीं रहता है. बट इन सम डिसऑर्डर्स मसल्स का टोन intact रह जाता है. And that's why then they have REM behavior disorders, in which they might act out their dreams. They might become aggressive while they are sleeping. Then there is an issue called sleep terror, जिसमें patient wakes up very frightened, suddenly screaming, चिल्लाते हुए, and wakes up मतलब they get up and sit in the bed, and if the relatives wake them up, the patient is very drowsy, groggy, disoriented, and typically they don't remember what they've been dreaming. It's a little different from nightmares because nightmares usually NREM sleep में आते हैं, and nightmares का प्रोग्रेशन कुछ ऐसा रहता है that the dream progressively worsens और फिर वो इतना खराब हो जाता है कि पेशेंट की नींद खुल जाती है, but they do remember what they were seeing after they wake up. So there's sleep terrors, there's nightmares. um, there's movement disorders. Movement disorders जैसे कि it could be restless leg syndrome जिसमें patient has this restlessness in their lower limbs. They want to move their legs. सीधा नहीं सो पाते हैं, पैर हिलाने की या उठ के खड़े होने की इच्छा होती है. Then there's bruxism, teeth grinding. A lot of people grind their teeth when they are asleep. So that is another type of a sleep-related movement disorder. Then there's another entity called periodic limb movement syndrome. So, these are different types of sleep disorders which occur in different phases of sleep. There are some normal behaviors also which occur in sleep, which some parents or relatives get concerned about. जैसे sleep walking हो गया, sleep talking हो गया. These are normal phenomena. Whenever clients come to us for treatment of these, we typically tell them that there's nothing that has to be done about it. The only thing is कि अगर sleep walking में the patient is engaging in dangerous behaviors, जैसे they are opening a window and trying to go out of it, or opening a door and trying to walk out on the road. So वहाँ पे we just recommend कि आप door या window lock करके सोइए just to ensure safety of the patient. क्योंकि typically इस दौरान if the patient is jerked awake, they can become very violent, they can become very aggressive. So we usually tell family कि gently just to turn the patient around and go and put them back to the bed and not try to wake them up and ask them what happened, what were you seeing, and all of that. So these are usually the normal phenomena. Then there's some other things like sleep paralysis, जिसमें it happens usually closer to waking up time when the patient becomes conscious, but the muscles का atonia doesn't go away, like the muscle paralysis remains in place. So there's a feeling of paralysis which can last for a few minutes. So that is sleep paralysis. So these are the different issues which can happen with sleep.
Yeah, one of my patients had tried to, like, two of my patients had tried to attempt cooking while they were awake. Sorry, they were not awake. They were sleeping,
They were
and
asleep.
they were attempting
Yeah.
that. And it was very dangerous because the fire was on, and one of them
Yes.
was almost going to put all of those Maggie noodles on herself, and the other one, but the other one was okay. She was just cooking, making a sandwich, so that's
Yeah.
okay.
Yeah, sometimes they can carry out like really complex movements during sleep. Jैसे window वाला example लिया, this was another client of mine, was like a teenager, and दो बार he had tried to open the window and climb out of the window, and then the parents were very concerned for the safety of the child. So sometimes they can do like really complicated movements like unlocking or unbolting the door and stuff like that.
But also, I think, if I am correct, and you can correct me if I'm not, that during somnambulism they do realize their surroundings, right? I mean, even if they're asleep, they do know कि यहाँ पे chair रखी है शायद, and यहाँ पे दीवारें हैं, so they can walk properly, right?
Yeah, a lot of, sometimes they can, मतलब purposeful movements रहते हैं उनके. So there's partial awareness maybe, but if you wake them up, then they will not be able to recollect ki, how did they
Right,
get
right.
there, or
It's almost like an
if they were
alcoholic
dreaming then what
blackout.
they were seeing. मतलब it's, that conscious brain is probably not registering what they are doing. It's only the subconscious brain that is working.
Right,
So there's no
right,
point in waking them up basically. Doesn't help.
right.
It's
Sanjeev?
a it's a little like it's a
Yeah,
little like when there is darkness. If you are at your home and suddenly there is a power cut, you'll still be able to navigate through your furnitures, right?
Navigate.
Because you
hmm.
have
Right.
muscle memory, you know where the things are, but you are not thinking while walking कि यहाँ पे chair है, यहाँ पे table है. You don't think that. You walk because there is a memory कि कहाँ पे क्या है. The same thing happens that while sleep you don't think कि कहाँ पे क्या है. It's just memory. So that is why.
Would you also like to add on, or
More or less, see, sleep पे एक एपिसोड से नहीं होगा. Probably we have to do two अगर ठीक तरह से कवर
डिटेल्स
करना,
में
because
जाना है तो, या
yeah, sleep disorder itself should take one episode,
फुल
because there are
एपिसोड.
so many and there are so many things. There is hypersomnia, excessive sleepiness, which is also it works in conjunction with insomnia. So if a person is unable to sleep during the night, they can face, it's called EDS, excessive daytime sleepiness, that can happen. uh, she already mentioned narcolepsy. So narcolepsy is already there. वो primary hypersomnia है, but there are some secondary hypersomnia which again बहुत ज़्यादा medical, बहुत ज़्यादा technical
Yeah,
हो
it's all
जाएगा,
very
so let's not get
technical.
into that.
Yeah.
Yeah. I mean बहुत
बिकॉज
rare
बिकॉज
cases होते हैं.
हाँ, एंड बिकॉज वी आर
So
डूइंग इट बेसिकली फॉर जनरल पब्लिक अवेयरनेस, इसलिए हम लोग बहुत डिटेल्स में नहीं जा रहे हैं फिलहाल.
I
बट
think I
वन
think
ऑफ
we
द,
have to discuss about good sleeping habits, hygiene, and
दैट तो वी
sleeping
आर
aids. So
कमिंग
वो
टू,
भी discuss
बिकॉज
करना पड़ेगा. Exactly.
एग्जैक्टली
उसके लिए
वो तो
टाइम नहीं
उस पे
बचेगा
तो.
फिर if we get into sleeping.
हाँ, आई नो, इसलिए. So just giving you an example, one of our school professors had narcolepsy. So where I was reading narcolepsy, I could understand in retrospection कि अच्छा हाँ ऐसा होता है, मैंने ये देखा है. That was good. Okay, moving ahead. Now, most of the people, as you know, they are very scared to take sleep medications. It's basically because they think कि उसका addiction हो जाएगा, constant उसकी आदतें लग जाएंगी. So, what are the ways in which one should promote natural sleep? So, we should go on to discuss sleep hygiene.
Right. So basically, sleep hygiene is also something that we very frequently advise, matlab, in all our patients who have sleep problems, because Surbi, you would also know that there's virtually
मैं खुद
no
को भी
psychiatric
advise करती हूँ.
illness. Yes, and matlab, most people need it, and there's virtually no psychiatric illness where sleep is not disturbed. So this is something that I speak to almost all my patients about, and I would like to take some time here. I want to go in detail little bit yahan pe, because I think this is what is the most relevant part of the talk for I think the
Most
listeners.
needed for today,
So
yes.
yeah. So uh, I will take it up in points. So the first thing that I recommend is to have a sleep schedule, right? अ, कई लोगों का ऐसा होता है ड्यूरिंग द वीक दे sleep very less 5 hours 6 hours and they try to compensate by binge sleeping over the weekends where they're sleeping 11 hours 12 hours, but it's important to know that that is not going to help. What you need is a consistent sleep schedule where you're giving your brain at least 7, preferably 8 hours of sleep every night. It's important to maintain a fixed sleeping time and waking up time. So कैसा होता है कि हमें कितने बजे नींद आ रही है that is not necessarily in our control, but we can control the time that we are waking up. So please maintain a constant waking time. अगर आपको रात में सोने में लेट भी हो रहा है तो don't try and compensate by sleeping late that day. Wake up at whatever time you fixed for yourself by setting an alarm. एंड जैसे आप उठने के लिए अलार्म लगाते हैं उसी तरह शाम में एक वाइंडिंग डाउन के लिए भी अलार्म लगाना चाहिए. नाउ दिस वाइंडिंग डाउन प्रोसेस शुड हैपन सी अबाउट एन आवर एंड अ हाफ before you go off to sleep. So set an alarm for waking up and set an alarm for winding down. When your body is used to sleeping at a regular time, it'll go to sleep more predictably and more regularly. If you're subjecting your brain to very big variations in sleeping time, कि कोई दिन 10 बजे सो रहे हैं, कोई दिन 2 बजे सो रहे हैं, तो then there's no rhythm to your sleep. So then your brain is also a little frazzled कि कब सोना कब है मैंने, there's no predictability to sleep pattern. Then very important thing is, which again I speak to all my clients about and which we briefly discussed, screen exposure bedtime के 1 घंटा पहले कम करना है. Screens could be televisions, mobiles, laptops, cell phones, computers, any screen, cut down screen activity because of a couple of reasons. Screens are typically bright images, they are moving images, so they stimulate your brain. स्क्रीन्स पे जनरली हम जो कंटेंट करते हैं वो एंगेजिंग रहता है, स्पेशली अगर हम मोबाइल यूज कर रहे हैं. वी आर ऑन सोशल नेटवर्किंग साइट्स और यूट्यूब और chatting with somebody is very engaging. Again, any kind of engagement will stimulate your brain, which will delay the winding down process, right? एंड जैसे संजीव जी ने बात की अबाउट एवोल्यूशनरी पर्सपेक्टिव, तो ये ब्लू लाइट के बारे में बड़ा चलता है कि स्क्रीन में से ब्लू लाइट आते हैं. मोस्ट ऑफ दीज मोबाइल्स नाउ गॉट ब्लू लाइट फिल्टर्स. यू गेट ग्लासेस which are supposed to have blue light filters. So what is the funda behind this blue light? um, we spoke about our time as human beings, but if we go further back, we evolved from sea organisms, right? There were sea organisms and there were fishes and then they were sea mammals, and that's how we came about. So millions of years back, when we were still not we मतलब जो हमारे पूर्वज थे, वो sea creatures, उनके लिए जब दिन होता था, the sunlight would filter through the water and in the oceans it would appear as blue light. So the very reptilian part of our brain, the very uh, primitive part of our
Primitive
brain,
part.
that was kind of switched on by the blue light, because तब daylight उनको sea creatures को yellow या white sunlight नहीं दिखता था. They would perceive daylight as a blue color around them, as a blue light. So that is what is triggering the primitive brain into a wakefulness cycle. So that is the funda behind this blue light which comes out of our screens. That blue light delays sleep onset. So no screens an hour before you go to sleep. Don't carry your phones to bed with you. I tell all my clients that's the worst thing you can do to your sleep, because inadvertently जब हमें नींद नहीं आती है हमारा फोन मोबाइल की तरफ चला जाता है, and then we tuk we either scroll through our social media or do something which is otherwise interesting, and that further delays our sleep. Then avoid stimulants, right? So screen is one kind of physical stimulants. बाकी chemical stimulants भी होते हैं, most commonly caffeine. So caffeine हमको मिलता है सबसे ज़्यादा इसमें energy drinks like Red Bull, coffee, to some extent even in tea. तो जब हम कैफीन वाली चीज़ें कंज्यूम करते हैं उसका इफेक्ट बॉडी में रहता है फॉर अबाउट 6 to 7 hours. So ideally your sleep hygiene says that people who have trouble sleeping, this is not true for everyone, but for people who have trouble sleeping, we recommend cutting down coffee and tea in the evening. Theoretically no coffee after 12 p.m. and no tea after say 4 p.m. So cutting down that is very important. Another stimulant is exercise. A lot of people don't realize this, but it might physically tire you out, but it stimulates your brain. The endorphin rush that your brain gets after exercising, that works as a stimulant, and uska effect stays for about 3-4 hours. So ideally, you should not be exercising anywhere within the 3-4 hour range of your bedtime, because that can also delay your sleep onset. Again, good sunlight exposure, what we've spoken about earlier. Get a good hour of sunlight before, after you wake up, and a good hour of darkness before you sleep. That kind of helps to reset your sleep cycle. One very important factor is psychological association of the bed with sleep, जिसको हम हमारे टेक्निकल लैंग्वेज में कंडीशनिंग बोलते हैं. The bed should only be used for sleep and sex. Just these two things, nothing else. जो दिन भर में बेड पे बैठ के न्यूज़पेपर पढ़ना, फोन पे चिट चैट करना, सब्जी तोड़ना, lying on the bed and watching television. No. Bed only has to be used for these two things, for sleep and sex, for nothing else. For anything and everything else that you do, please use a chair, sit on the floor, but not the bed. Because इसमें क्या हो जाता है कि ब्रेन का जो वो कंडीशनिंग है ना स्लीप के साथ बेड का, वो टूट जाता है. If I were to explain by an example, अगर हम क्लासरूम में जाते हैं, so we there's this whole माहौल जिसको हम बोलते हैं, there's lines of desks and chairs and a blackboard in front. So that kind of puts our brain into a study mode. कि now you've come to a place of study, यहाँ बैठ के पढ़ना है. So you need to concentrate more, you need to focus. उसी तरह बेड का एसोसिएशन स्लीप के साथ रहना बहुत ज़रूरी है, which often breaks because of different activities that we do on the bed during the day. In the same vein, I would like to say that it's important to not remain awake in bed for a long time. So, for example, if you go into bed and you have trouble sleeping, don't lie awake in bed for long stretches of time. Ideally, we say not more than 20 minutes. And this is andaze se, matlab clock watching is also not recommended. But once you get into bed for about, say, 20 minutes, if you're not able to fall asleep, come out of bed, sit on a chair and do some relaxing activities, like you could practice some breathing techniques, or do some light reading, or listen to some, music which is soothing. And then again, once you feel sleepy, then go back into bed. Uh, uh, your winding down process could be linked to it, so जो लाइट्स डिम कर देना होता है, wearing your night suit, listening to mild music. Some people like to use lavender or other such scents which kind of help them feel soothed down and go off to sleep. So this kind of a routine works well. uh, Another important thing is to avoid alcohol if you have sleep issues. Alcohol, you might feel that after taking it you go off to sleep well, but that's basically because alcohol is a brain suppressant. It suppresses your central nervous system. But जब तक उसका इफेक्ट रहता है तब तक, once the effect starts wearing off, your brain hyperfires in withdrawal. And alcohol is a known suppressor of REM sleep. So जो ये बाद बाद में जो REM sleep आता है, alcohol is known to disrupt it. So you might fall asleep quickly, but then your early morning sleep is not good quality at all. You might wake up very early and not be able to go back to sleep. So alcohol is definitely a no-no. Similarly, nicotine is also very harmful for your sleep because it causes again micro breaks in your sleep during the night. Eating very heavy meals at night should be avoided, because uh, your body takes some time to digest it. If you go off to bed right after a very heavy meal, you feel very bloated or abdominal heaviness लगता है, तो एटलीस्ट 1 to 2 hours का गैप होना चाहिए, मील थोड़ा लाइट होना चाहिए. Don't drink too much water right before going to bed, because then you might have to get up again and again to use the toilet, and that again causes a big sleep disruption. So time your eating and drinking well, and be mindful of the quantum also that you're consuming. And the last point I would like to mention is डोंट टेक आफ्टरनून नैप्स. हमारे यहाँ इंडियन कल्चर में आफ्टरनून नैप्स का बड़ा इंपॉर्टेंस है. दोपहर में बहुत लोग मैंने देखा है सोते हैं, एंड सोते हैं मतलब 2-2 3-3 घंटा सोते हैं, ऐसे नहीं कि लेटते हैं, दे लाइक प्रॉपर स्लीपिंग इन द आफ्टरनून. दैट इज अगेन नॉट रिकमेंडेड, बिकॉज इनिशियली जो मैंने एक वर्ड यूज किया था स्लीप प्रेशर, जो स्लीप प्रेशर डेवलप होना चाहिए ब्रेन में, जो एडेनोसिन नाम का केमिकल है जिस तरह से बिल्डअप होना चाहिए ब्रेन में, वो नहीं होता है अगर आप बीच में से ही 2 घंटा सो जाएं तो. इट काइंड ऑफ सब्ट्रैक्ट्स फ्रॉम योर स्लीप डेफिसिट, and it then gives you trouble later falling asleep timely at night. So please avoid afternoon naps. If you are very tired, not for more than 30 minutes, and that too before 3 p.m. Then after 3 p.m., please don't take a nap. So I think these are mostly the important points of sleep hygiene that I discuss with my clients.
I think you have covered everything almost. I don't think there was anything else to be added, but in case Sanjeev wants to go ahead with something, maybe if you would like to, just add on maybe the sleep aids as you were talking earlier, that what are the sleep aids and how do they work?
Yeah, we'll come to sleep aids. I think a couple of points. Uh, actually, she has put everything so beautifully and she speaks so well. It's difficult to follow up. It's a tough act to follow. Okay, but I'll try. I'll try.
Yeah,
See,
try.
I'll say something which is a little more on the spiritual or the philosophical side. It's just like music जो है, if you have to give it time, right, to become masters, we say 10,000 hours of something practice makes perfect. So if you want to be a master of something, you have to give something 10,000 hours of your life. तो वैसे ही sleep is something that you have to take very seriously. Most people don't do that. They think अरे ठीक है खा लिया अब कुछ सो भी लेंगे उसमें क्या है.
मेरे जैसे लोग हैं वो.
If you, हाँ, I mean, yeah, there are people, see, the thing is when you're younger,
Yeah.
there are a lot of distractions. As you grow up, you understand the importance of sleep. Some people sleep because they love to sleep. That's a different thing altogether. But the importance of sleep, the health benefits, the issues that you will face if you don't, these you realize as you grow up, as you age. So यही बोलना था कि people that I speak to, people who have consulted, that whatever she said, those are the points. But what we have done is we basically broke them down to few things that they can easily digest. तो एक तो है कि गुड हैबिट्स में आ जाता है वो इंक्रीज्ड एक्सपोजर टू डे लाइट एंड रात को यू शुड प्रिपेयर योर सेल्फ फिजिकली एक्टिव रहो अल्कोहल मत कंज्यूम करो कैफीन मत कंज्यूम करो दिस दैट देन द नेक्स्ट इज स्लीप शेड्यूल
फिर भी
तो वो
बैंकवेज
ध्यान में रखना
बराबर रात में ही होंगे. उनका क्या नेहा मैम, कुछ तो करना पड़ेगा. उनको बोलो रात में ना रखा करे. Anyway, sorry,
doctors
continue. Yeah.
BPOs and doctors, so they have night shifts, right? But uh, but if you have to manage it somehow. ऐसा नहीं है कि your entire life 30-40 years of your adult life you will be sleeping in the morning and you will be awake in the night. ऐसा usually नहीं होता. तो सेकंड पॉइंट इज स्लीप शेड्यूल मेंटेन करना. व्हाट शी सेड कि एक फिक्स टाइम पे सोना है, एक फिक्स टाइम पे वेकअप करना है. एक दिन वी स्लीप एट 3 एंड वेकअप एट 12, नेक्स्ट डे वी आर स्लीपिंग एट 9 एंड वेकिंग एट 5. दैट इज नॉट गोइंग टू हेल्प. योर ब्रेन विल बी ऑल ओवर द प्लेस. अरे कब क्या करना है. सो दैट इज वेरी इंपॉर्टेंट. स्लीप को हम प्रायोरिटाइज नहीं करते हैं, तो दैट इज वाई वी डू दीज थिंग्स. नेक्स्ट इज बेडरूम जो है जहाँ पे आप सोते हो उसको एक प्लेस ऑफ वर्शिप की तरह ना इसको ऑप्टिमाइज करना पड़ता है. यू शुड बी यू शुड मेक इट अ वेरी नाइस प्लेस टू लुक फॉरवर्ड टू कि अभी दिस इज द टाइम मुझे 10 बजे सोना है. सो दैट 10 यू शुड लुक फॉरवर्ड टू दैट 10 PM. ये नहीं होता. लोग जस्ट 9:50 को जाते हैं एंड देन एक्सपेक्ट टू फॉलो स्लीप बाई 10. दैट इज नॉट गोइंग टू वर्क. यू हैव टू प्रिपेयर योर सेल्फ. तो वो जो म्यूजिक के लिए जो होता है, क्रिकेट के लिए होता है, फुटबॉल के लिए होता है, वो भी स्लीप के लिए भी चाहिए. यू हैव टू प्रिपेयर योर सेल्फ कि अभी मुझे 10 बजे सोना है, तो 10 बजे से हाफ एन आवर पहले तक आई एम नॉट गोइंग टू एंगेज इन एनीथिंग. आई एम नॉट गोइंग टू गेट इन टू ओवर थिंकिंग, क्रिटिकल थिंकिंग, यू नो talking to people over the phone, or trying to solve complex problems, personal ho ya business. I'm not going to look at the phone, not going to look at the TV, anything that excites our brain. मैं ऐसा कुछ नहीं करने वाला करने
They
वाला.
also say
That is
that
the most.
even if you're reading, so it should be like, as she said, light reading. It should not be stimulating reading, like thriller पढ़ रहे हो,
Yes,
mystery suspense पढ़ रहे हो, वो नहीं होना चाहिए.
yes, yes.
I'm a
तो
victim
अब
of
पढ़ने
this
के
when
लिए
I read
Same
novels
here,
and then
same
I
here.
get into them and वो 15 मिनट का 1 घंटा कब हो जाता है and and then I feel guilty.
And especially when the
See,
chapter ends, it's like you have to go to the next chapter to know what happened next.
Yes.
So,
but then are you talking about a book or are you talking about ebooks?
no, no, book. E-books तो वो भी नहीं करना चाहिए. But even with the paperback
Ebooks,
books that we are talking about,
yes.
they should also not be
Ebooks
stimulating.
में that is the reason why Kindle has a yellowish,
Yes.
screen, because so many people read Kindle at night that they have, एक तो उन्होंने स्क्रीन ही थोड़ा येलोइश कर दिया है, then they have a yellowish tone inside as well, which हमारे फोन में भी आजकल आते हैं. If you use a phone, it will tell you कि you can set the clock कि शाम को 5 बजे के बाद the screen will automatically become yellowish, so that it starts kind of massaging your melatonin secretion कि हाँ भाई अभी तुम तैयार हो जाओ. So that is what I'm saying कि it's very important that you prepare. Next is temperature has a good effect on the body. So keeping your it's said it's still research चल रहा है, but it is suggested that if you can cool down your bedroom का जो temperature है, it aids your sleep. It helps you in falling asleep faster. तो the ideal temperature is 18 to 24, but then that तो उसका मतलब है rest 80% of India cannot afford to do that. Only in urban setups where you have AC you can do that, right? Or in the winter. But that helps. But ऐसा नहीं है कि उसके बिना नहीं चलेगा. That is just one of the suggestions. And melatonin, as Dr. Neha has already said, that it starts secreting after there is darkness.
Darkness.
जब set होता है तब अब how it is tuned in different human beings, it will be different. Like what happens with you and what happens with me might not be the same. It could be that it happens much slower in your case and faster in my case because I'm better trained. How I train my body over a period of 20 years, 25 years, 40 years will also determine कि कब मेरा शुरू होगा. So if I can dim the light 1 hour before I sleep, I might be actually telling my brain कि देखो I'm in the process of preparing, so तुम भी शुरू कर दो, तुम खाना गरम करो, मैं नहा धो के आता हूँ times. So that is also something that you can do. And
Winding down तो सिर्फ
noise.
मेरे फोन में दिखाता है, मैं खुद नहीं कर पाती हूँ. My phone starts winding
हाँ
down. I can't.
हाँ, तो वही ना, that is because the major
Yeah.
point, you are not prioritizing sleep.
And I'm not
The day you
conditioned.
prioritize
Yeah.
sleep, yes. So you have to condition yourself कि मुझे सोना है, दुनिया जाए भाड़ में, मुझे सोना है.
Hmm.
That I'll tell you from my personal experience. I used to sleep at 1:32, 2:33 in my younger days. अभी मैं 11 बजे फोन को कर देता हूँ साइलेंट और मैं सो जाता हूँ. If anybody wants to initiate any chat, it has to be before 10:30. 10:30 के बाद अगर कोई मैसेज करता है, इफ इट्स अर्जेंट आई रिप्लाई, अदरवाइज मुझे अगर दिखता भी है मैसेज और मुझे लगता है इफ आई इनिशिएट अ चैट इट विल ड्रैग ऑन, मैं नहीं करता. इफ somebody is
Surprisingly,
calling me after 11.
what was happening with me was that sunrise, like the first rays of the sun and the chirping of birds, would induce sleep. And then I would get up around 11 or 12, 11 a.m. or something. Like 5, 5:30 a.m. I
कंडीशन
would
होगी.
sleep after studying. Yeah, and then 11 and 11:30 a.m. I would get up. So that was how I was conditioned. उल्टा मतलब पूरा उल्टा.
कंडीशन. सो ये साउंड नॉइज इसको हटाना है कि मुझे सोना है. यू हैव टू बी वेरी एक्सट्रीमली कमिटेड एंड डेडिकेटेड. ये कुछ, इफ यू डू इट कंसिस्टेंटली, आफ्टर अ व्हाइल यू विल सी बहुत ज्यादा स्ट्रिक्ट ना होने से भी यू आर गेटिंग गुड स्लीप. So that is very important. And she already mentioned, calming sense and relaxing music. That it's like, you लोग सेक्स के लिए भी मूड बनाते हैं, तो स्लीप के लिए भी मूड बनाना चाहिए. वैसा इंपॉर्टेंस देना चाहिए स्लीप को, तब जाके कुछ होने वाला. I mean,
क्या बात
I'm
बोली,
just
वाह.
saying, if people register this, I don't know if that is
Yeah,
going
they
to
they
make
may
people
register
understand.
that as well.
And
Okay.
also
There
one
is
one thing is
also,
one thing is
yeah. Continue,
no one thing
continue.
is, if you sleep and if you see that you're unable to fall asleep because something disturbing is going on, कि ऑफिस का चिंता है, घर वालों की
Hmm.
तबीयत का चिंता है, कुछ कुछ समथिंग इज हैम्परिंग योर स्लीप, देन you should go and take a walk inside the room, inside your home, or maybe you can sip a glass of water or half glass of water. You can listen to something relaxing, but स्टिमुलेटिंग कुछ नहीं करना है, खुद को रिलैक्स करना है, वो याद रखना है. That's about it. So you prepare
Now
yourself.
when we
See,
go for a massage,
yeah.
when we go
That,
to a
but
spa,
then
you know, the lights are dim, they've got some nice scented candles,
yeah,
or there's some fragrance in the room, and there's soothing music as instrumental going on in the background, so the whole place is designed to make you feel like really relaxed and calm. So that is kind of the mode you need to put your brain in before you expect
that
it
is
to sleep.
exactly the setup you need to do at your home. खुद
Kind
को
of.
मसाज नहीं दे सकते, but that is exactly what you need to do with your room as well.
Yeah.
The same thing.
There is also a
So
comment,
yeah,
and I
that's
think it is also a part of sleep hygiene, if I'm not wrong, that you may have a warm water shower maybe 2 to 3 hours before you sleep. So
Yeah.
that may also enhance, yeah,
I
or
don't suggest warm water shower, but a shower can help, because when you shower, your body temperature goes down. If you take a hot water shower, your body temperature will go up. So you should not take a warm water shower. ये मेरा मानना है, but Dr. Neha
But
can
again,
probably agree.
I think this is again a bit of a tricky area, because
Yeah,
there's
very
also
tricky.
some literature which says that cold showers wake you up and hot showers put you to sleep. So in the morning, ideally your water temperature should be cold, and night you need to take body temperature raising baths, to facilitate dopamine secretion in your brain and to kind of help you sleep. But I think this thing is a little variable for different individuals.
hmm,
So I'm not sure there's like a one size fits all formula here. बट बच्चों में हम देखते हैं छोटे बच्चों में, लाइक वेरी स्मॉल टॉडलर्स, उनको रगड़ा रगड़ा के मालिश करवाते हैं, एंड देन नाइस हॉट बाथ यू गिव देम, एंड देन दे स्लीप फॉर 3 hours 4 hours straight, so I think it's working there, and it also works for some adults. Like I have children who are young, and they are 6 and they are 3, and when I make them have a bath with like hot water sham mein, I've seen they fall asleep faster.
hmm.
So I think it's a bit of a tricky thing, this one.
True, true. But I personally, मेरे लिए cold shower works better. So my brain gets conditioned that lowering of temperature, that means your body is shutting down, you're getting ready for
Yeah,
sleep. So I
So
kind of fool
thoda
my
thoda
body.
individual difference रहता है, because I have also noticed some
True.
people saying that some people like to sleep in complete darkness, but some people prefer a little dim light in their room before sleeping.
nice
So it's
lights.
about,
Yeah.
yeah, so it's about their comfort zone कि उनको कौन से atmosphere में better sleep आती है. So it's very
And
individualistic.
one thing I'll mention here, Surbi, I mean, everybody's heard these terms night owl and morning lark. So ये basically जो individual wakefulness रहता है, ये थोड़ा variable रहता है. So there are, we all know a bunch of people who are more productive during the night hours. And even as students or as working professionals, they have higher productivity during the night. And there are some who are like up at 5 a.m. and they're like सुबह exercise and सुबह उठ के पढ़ाई, and so those are morning larks.
Yeah,
So it's been seen that about 40% of people have like peak wakefulness in the morning hours, and about 30% have peak wakefulness in the night hours. So सबका प्रोडक्टिव जोन जो रहता है, ब्रेन का एक्टिव जोन जो रहता है, वो थोड़ा अलग रहता है. सो इसलिए ये
right.
जो सुबह 5 बजे उठ के जल्दी डे स्टार्ट करना चाहिए, दिस डजंट रियली अप्लाई टू एवरीबडी. आई मीन सम पीपल
Everyone.
माइट नॉट फंक्शन वेल विद इट. या
Because personally speaking, highest productivity मेरी तो रात में ही रहती है. When I'm like very active in the night time, and I am basically a writer mostly. I mean, my passion profession is writing. So I write really well when I am active in the night time, and I can think properly in the silence of the world, because नहीं तो दिन भर the noises are disturbing, and I mean it's not an excuse, it's just how I am. And I
so you're
think
a
there is,
night
But
owl.
that is how it
I'm a
is with a
lighter.
lot of other people.
Yeah,
Because
yeah. Even
it is
A.R.
again
Rahman, I
how
have
you have
heard that
conditioned yourself.
yeah, I have heard that A.R. Rahman creates music mostly during the night time, and
Night.
he,
Yes.
yeah. Similarly, there is a question here as well, by Nilanjan, that how does Shahrukh Khan manage to be full of energy even though he sleeps for only 4 hours, whereas if I sleep less than 7 hours, I feel sleepiness during the day.
या सो एक्चुअली इसमें भी थोड़ा वेरिएशन है. Some people are classic long sleepers, like they
Yeah.
require minimum 8 9 hours of sleep, and I think this is where most people lie. But थोड़े outliers होते हैं who are short sleepers, and they can function very well with just 4 5 hours of sleep. So we've heard of examples of celebrities जैसे शाहरुख खान हो गए या नरेंद्र मोदी हो गए, who can sleep like very small hours and yet be completely functional. I have friends who can just manage with 4 5 hours of sleep. सो वो भी एक इंडिविजुअल ब्रेन का रिक्वायरमेंट रहता है. सो या पीपल आर क्लासिफाइड एज शॉर्ट स्लीपर्स एंड लॉन्ग स्लीपर्स. आई एम अ classic long sleeper, and I feel your pain, but it's just how your brain is made, and that's just your brain's requirement. So
But I think in addition to that, a lot of people also take daytime naps. A lot of celebrities do that. Shift के बीच में या after coming back from a shoot, they take 1 hour power naps. So that helps. There's something called sleep debt. वो जमता है.
Yeah.
वो if you don't have that, but it's not a good idea. Sleep debt को weekend में clear करना is a very bad idea. हम लोग करते हैं
Yeah,
कि
that's what she said
वीकडे
earlier,
में
right?
5 वीकडे में हम लोग ठीक से सोए नहीं, देन वीकेंड में हम लोग 12 12 घंटा सो के वी थिंक कि हम लोगों ने उधार चुका दिया, बट दैट इज नॉट वेरी गुड. It's not very healthy.
and a
Having
lot
said,
of people who, yeah, sorry,
no, no, go on, go on.
a lot of people who sleep less also use performance enhancers, like coffee is one classic thing which people use to stay up till later and be more productive. People who use like hard drugs, also cocaine and all, are known to be like stimulants, high grade stimulants, which significantly reduce the requirement of sleep. तो मतलब इसका भी एक element रहता है.
Yeah, yeah. And the other thing, that point I was trying to make is, uh, I initially spoke about long term effects of lack of sleep, right? So you won't see uh, you won't see these effects in a person who sleeps less, but over the years, if see, we see that Shahrukh Khan is very energetic. That's a very generic term to say, because we only see him energetic during shoots, during this, during that. We are not observing him over a period of 24 hours, over a period of 1 or 2 years, right? We are not seeing that. हम वही देखते हैं जो मीडिया हमें दिखाती है. So that is one. Second is, if you go and do a complete blood analysis of these so-called celebrities, you will find out कि उनके आधे organs, मतलब 30% 40% गए. मतलब लीवर, उनका किडनी, किन कुछ कुछ लोगों का सीकेडी है, इनका नॉन अल्कोहलिक फैटी लिवर, दिस दैट, स्टमक में प्रॉब्लम, इंटेस्टाइन में प्रॉब्लम. So we are only seeing them jumping around with shots of, as she said, coffee, or we shouldn't say cocaine. So these. So we
But you
see
did say
that
cocaine.
what is it?
Haha.
Yeah. So that's what I'm saying. That उनका क्या चल रहा है अंदर, how healthy they are, we really don't know. I mean, except for the probably the exception of Jitendra, Anil Kapoor, who are still active, who have still actively worked after 60, very positively and very healthily worked after 60. There are very few people in Bollywood who has been healthy and who has kind of continued to work. Almost all of them have been unwell. Even Amitabh Bachchan, he has been chronically ill since the last 20 years, 20 25 years. So no reason to get fancy about Shah Rukh Khan being energetic and all. Just mind your own sleep. That's all I say. Don't hack after Shah Rukh Khan.
Okay, so I think we should look at the remaining comments and we can wrap up after that. Yeah, so the
Yeah, I
question
think we
is
can also discuss sleep aids in very very, you know
briefly, yeah, we can
short.
do that.
Yeah, briefly.
But we can
Just
first
one.
answer this question by Rupa Ray Burman. Does walk after dinner help a good sleep?
Yeah, so a light, this is not like a very fast walking or an intense walking, but जिसको ambling बोलते हैं, light walking या light stretching exercises, they're shown to be helpful in falling asleep. So no rigorous exercise, but walks can help because they help in digestion and prevent you from feeling bloated or heavy. So they might help. Yes.
Okay.
Yeah, it just helps in digestion. It utilizes the food you eat. स्लीप पे बहुत ज़्यादा इफेक्ट नहीं करता. उल्टा if somebody overdoes this thing, it might actually get the body into a more active, more wake up woke up state and det- cause detriment to the sleep. So it has to be light walking, not very intense.
Okay, we can quickly talk about sleep aids and then we can finish off with our session today. So, yeah.
I think drugs जो है prescription drugs, I think Dr. Neha would be able to probably pinpoint better. So I think I can talk about the other drugs, other stuff, other sleep aids which are available. We will go through TCAs and SSRIs and other stuff that is being used. Let Dr. Neha start and then I'll.
Yeah, I'll just speak about this very briefly because you can't get this without a prescription. So you will have to
Yeah,
come to me to
that's
get
the
it.
best.
But but basically, yeah, there are medications that help you sleep. एक बहुत कॉमन मिसकंसेप्शन रहता है अबाउट साइकेट्रिक मेडिकेशन दैट दे ऑल जस्ट मेक यू स्लीप. ऐसा नहीं है, बट येस देयर इज अ स्पेसिफिक क्लास ऑफ मेडिकेशंस व्हिच इज यूज्ड स्पेसिफिकली टू हेल्प पेशेंट्स स्लीप. वी कॉल देम सेडेटिव्स. लॉट ऑफ एंटी एंजाइटी मेडिकेशंस आल्सो हेल्प यू स्लीप. तो इसमें अलग अलग केमिकल क्लासिफिकेशन रहते हैं, बेंजोडाइजपीन्स रहते हैं, बार्बिचुरेट्स रहते हैं, जेड ड्रग्स रहते हैं. बट जो कॉमनली यूज है, वी यूज लोराजेपाम, क्लोनाजेपाम, जोल्पिडेम, these kind of drugs for helping patients sleep. There are some antidepressants, some mood stabilizers जिनका एक sedative effect रहता है, so we try to use it to our advantage whenever we are prescribing. But bottom line is that sedatives should ideally be taken short term. They should be taken under strict medical supervision because yes, you can get used to sleeping with the help of medications, and then it becomes a little difficult to kind of wean the patient off these drugs. So please use it only how as it has been prescribed by a doctor, and in minimum possible doses and for a minimum period of time. That's all I would like to say about the prescription drugs that we give for sleep. And of course their overdose could be dangerous, so keep them out of reach of children, or be very careful about how you consume these foods.
Yeah. So I think apart from that, one very commonly used drug when you have that is amitriptyline. It's basically a tricyclic antidepressant, but डॉक्टर्स लॉट ऑफ डॉक्टर्स इंसोम्निया के लिए देते हैं. A lot of people who have डिप्रेशन और हाई लेवल एंजाइटी, उनको स्लीप का भी इशू होता है. सो इट हैज़ वर्क विद देम, तो इनको ऑफ लेवल ड्रग्स कहते हैं. तो देते किसी और चीज़ के लिए है, बट दे हैव सीन दैट दिस वर्क्स वेल विद अ पर्टिकुलर कंडीशन. सो उसके लिए भी इसको प्रेस्क्राइब किया जाता है. दैट्स व्हाई दे आर कॉल्ड ऑफ लेवल. तो ऑफ लेवल ड्रग में दिस इज द मोस्ट कॉमन एमिट्रिप्टिलिन विच इज़ अ TCA. This is SSRI, but then TCA works a little better. Amitriptyline works a little better efficacy wise, but SSRI का overdose कम होता है. TCA का overdose हो गया तो it becomes very toxic. So as Dr. Neha said, you should ideally not try to do this, and this should not go to the medical store and ask for it. Most of the stores won't even give you, but I have seen some stores actually give you amitriptyline. I have gotten amitriptyline without a prescription, which I don't know. I thought I wouldn't get, but I saw that
Some
they were giving.
pharmacies even give benzodiazepines and all without
Yeah,
prescription.
they shouldn't.
Some of them are doing
They
that.
shouldn't.
Yeah.
तो दैट इज देयर. एंड इसको ना ये कुकीज और इसकी तरह नहीं लेना चाहिए कि मुझे नींद नहीं आ रहा है तो मैंने ले लिया, वैलियम ले लिया, ये ले लिया, एमिट्रिप्टिलिन ले लिया. ये सब बिल्कुल नहीं करना चाहिए. गो टू अ साइकियाट्रिस्ट इफ यू आर हैविंग एंजाइटी डिप्रेशन. गो टू अ जनरल फिजिशियन एंड टेल देम कि मुझे क्या क्या प्रॉब्लम हो रहा है. इफ दे थिंक you have issues, then they will figure out कि आपको क्या प्रॉब्लम है. if there are any other medical conditions, if there are conditions which will govern कि क्या देना चाहिए नहीं देना चाहिए. if you are if you have undergone surgery or if you are taking other medicines, सब कुछ ध्यान में रख के you should have it. मन किया ले लिया, that should not be. अनदर ग्रुप ऑफ ड्रग्स एंटीहिस्टामिन है, जो कि एंटी एलर्जिक बोलते हैं हम लोग. उसमें भी sedative होता है, तो a lot of people take that as well.
Sometimes people just take
और
cough syrup unnecessarily to sleep off.
yeah,
That also happens.
that is उनका नशा भी करते हैं कफ सिरप,
हाँ
because
हाँ.
that is what it does ना, it gets into a positive feedback loop. तो जितना लोगे उतना डोपामिन निकलेगा, and it gives a reward system and अच्छा लगेगा, and then you take more, so on and so forth, it goes on. So that is there. And apart from that, there are some pretty much comparatively safer um, supplements called melatonin supplements. आजकल बिकते हैं, सेतु का है, and then other companies which are melatonin and kava. So these things are there, but मैं मेरा ये बोलना है कि पहले आप खुद को तैयार करो, कंडीशन करो, do the good habits that Dr. Neha has said, do everything that is required. उसके बावजूद, उसके बाद भी अगर किसी वजह से नहीं होता है, only then you can consult a sleep specialist or a general physician or a psychiatrist and tell them what exactly is bothering you, why you are unable to sleep. ऐसा नहीं हो सकता है कि you are perfectly fit, everything is fine, and still you are unable to sleep. It will only happen if either you are extremely anxious or depressed, or you have any other physical condition that is preventing you from sleep, like sleep apnea, central sleep apnea, stuff like that. So we have to figure out what is causing the sleep disturbance and then take it from there.
Okay, so we have already overshot our time by almost
Yeah,
16, 17 minutes. Uh,
yeah, yeah.
yeah. So today's session was wonderful. And you can flash the rest of the comments if you want to by then. And I'll just quickly wrap up. So thank you so much, Dr. Neha, for coming and speaking about one of your favorite topics, and which was a very, very important topic, and it was long due on our show. So thank you for
Yeah,
being very informative and elaborative. And
Thank you for having me.
welcome.
yeah, she has pretty much hit the ball out of the park.
हाँ,
Thank
मतलब
you, sir.
I think you were kind of unnecessary in this session, but okay.
Yeah, I I
Oh
I
no, please
realized
don't say that.
I realized it about 10 minutes into the session.
हाँ,
कि
me too.
what am I doing here? She knows everything.
हाँ, मैं मतलब आया ही क्यों?
Yeah.
No, it was so
ठीक है,
nice
चलो दिखा दिया.
sharing the platform with you.
She's being too humble, but yeah, understood. So, okay, and thank you, Sanjeev, also for joining us. And you rarely show your face, and today was the second time that हमें ये मौका मिला आपका चेहरा देखने का.
Again, as Dr. Neha said, very very close to my heart topic. This is something that I've
Yeah.
बहुत पापड़ बेले हैं इसको तैयार करने में, मतलब this is subject that I've given a lot of hours, 10,000 नहीं, but given a lot of hours studying this, getting certified for this. So I talk to a lot of people that they should take up sleep more seriously than they do.
Yeah, and he keeps talking to me regularly about that, just that I don't listen. So, I think I should go to Dr. Neha for a consultation, like a proper one.
I think you should.
I think I should. Yeah. Okay.
Professional
So thank
consultation,
प्रोफेशनल वन
not
हाँ और
catching up.
प्रोफेशनली लूंगी तो ही
Not
सीरियसली लूंगी ना तो ही
नेहा
सीरियसली
दीदी
ले
आ गए
पाऊंगी
आपसे बात करने टाइप्स नहीं, पैसे दे के प्रॉपर कंसल्टेशन, शी विल टेल यू व्हाट टू डू एंड ऑल करके.
या so thank you both of you and just to wrap up you can always see our website on Facebook and our channel on YouTube and like comment and subscribe. You can comment as to what next you would like us to cover and the kind of speakers you would want us to have on the show. And yeah, regarding the teleconsultation app, Dr. Neha, we would like to show you a demo very soon, and all the others who would like to be recruited on that and get more and more teleconsultations as well. So thank you so much for being a part of our audience as always, and it's wonderful to have you people. Have a wonderful Saturday night, but a good sleep.
Bye bye. Thank you.
Bye
Bye
bye.
bye.
Thank you.